To start an IV, you will need clean gloves, IV dressing, IV needle, alcohol swabs, sterile gauze, extension set, normal saline flush, tourniquet, tape, and hand sanitizer. First, perform hand hygiene. Open your saline flush and remove any air in syringe. Attach extension set onto saline flush and prime set with normal saline. Open your dressing, gauze, and needle packaging. Next, apply clean gloves. Apply tourniquet on patient 4 to 6 inches above intended IV site. Have patient make a fist to help fill veins with blood. Find a vein that is palpable, straight, and away from any scar tissue. Then release tourniquet and clean chosen IV site using alcohol swab with friction. Allow to dry, then reapply tourniquet. Take your IV needle in your dominant hand and inspect the tip. Anchor the vein using your free hand by putting your thumb below the vein and firmly press down and pull the vein back to keep it straight and prevent it from rolling. Have the IV needle in your dominant hand with the bevel facing up. Insert low and slow. The angle should be between 10 to 30 degrees. Insert into the vein until flashback occurs in the chamber. Once flashback is visualized, lower the angle of the needle so it's almost flush with the skin and advance 1 to 3 millimeters into the vein. Then advance catheter into the vein while at the same time retracting the needle into the safety cartridge. The pointer finger pushes the catheter in the vein while the thumb and middle finger pull the cartridge back. Next, release the tourniquet and apply the IV dressing. The dressing should cover the hub of the catheter. Place a sterile 2x2 gauze under the hub of the catheter. Loosen cartridge from the hub of the catheter but remain in place. Take the cap off the end of the sterile flush. Occlude vein by pressing down firmly above the vein insertion site with your index or pinky finger. Pinch the hub of the catheter and take off the IV needle cartridge and thread on the extension set. Remove gauze and check to see if there's blood return by gently pulling back on the saline plunger. This is evidence that the catheter is in the vein. Then push the plunger down to flush the vein and then perform a positive pressure lock or a pulse lock. Remove syringe and apply a piece of tape over the hub and extension set connection. Then write down the time and date on another piece of tape and secure the extension set. Place all sharps in an appropriate receptacle and clean up supplies.